So, you're going to have a health fair. The purpose of this video is to help you put on the most effective health fair possible, so that community members leave with new information and skills to live healthier lives. To equip you to conduct this kind of health fair, we will cover 3 major health promotion and health education concepts: health communication, health literacy, and cultural competence. My name is Caitlin Ashmore, and I'm with the Department of Preventive Medicine and Community Health at UTMB. And our goal is to help you to improve the lives and health of the people who will attend your health fair. Let's review the 3 essential goals of any health fair: increasing health awareness through health screenings and health promotion activities, teaching participants new healthy behaviors to implement into daily life, and finally, creating a friendly, inviting, and hopefully fun environment. Having fun is one of the 3 goals because when putting on a health fair, you are a guest in the community. This is not an office visit. Community members will choose to attend health fairs if they are an enjoyable experience. And the best way to make your health fair a fun experience is to be respectful, flexible, and to enjoy it yourself. Health fairs are also beneficial to your education and career. They give you a time to practice screening and communication skills that will be valuable in future patient interaction. The benefits of putting on a health fair are twofold. You gain practice to become better healthcare providers, and the new community members gain new insight into their health status and ideas on how to be healthier. As a side note, throughout the video, we'll refer to our community members who will be attending the fair as participants and as our target audience. So this video will primarily focus on how to do health promotion. The health screenings that you are trained to do are an essential part of a health fair, but preventive screenings alone will not teach participants how to decrease the blood pressure you're measuring or how to improve their cholesterol levels. Without health promotion and health education, participants may just leave feeling discouraged by their results. If you incorporate sound health promotion practices, then the health of participants, as well as the effectiveness of your health fair, could greatly improve. The first of the health promotion concepts that we will cover is health communication. The Centers for Disease Control and Prevention, the CDC, defines health communication as creating change by changing people's attitudes and/or modifying and eliminating certain behaviors. This is really hard to do. Social marketing principles can be applied to help people adopt new, healthy behaviors. Social marketing is the use of basic marketing strategies, such as the 4 Ps, product, price, place, and promotion, to influence human behavior to improve health. So what are your 4 Ps? Your product. At a health fair, your product is new, healthy behaviors. Instead of selling something tangible, you pick one or a few key behaviors to sell to your participants, so that they will walk away with an idea of how to make healthier decisions. Price. You should explain the financial, emotional, or time barriers that the participants may face when trying to implement new health behaviors, and prepare strategies for how to overcome them. Place. Suggest a few places where participants can try out these new health behaviors. And promotion. Communicate messages in a way that your target audience can understand. By incorporating these points when discussing health behaviors with participants, you are likely to ignite some real change in their lives. Practice using the 4 Ps with your teammates to describe the health behaviors you will most likely be trying to sell. That last P, promotion, brings us to our next health promotion concept, health literacy. The CDC defines health literacy as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. According to a national survey of adult health literacy, 9 out of 10 adults may lack the skills needed to manage their health and prevent disease. And these rates were found to be even higher among older adults, persons with limited education, minorities, persons of low socioeconomic status, and persons with limited English proficiency. This high rate of low health literacy is a potential barrier to your success as a healthcare provider in general, and specifically at this upcoming health fair. It is important to communicate well with participants that may have low health literacy, and being understandable to a target audience is key to doing so. So here are a couple tips to being understandable. First, don't use technical and medical terminology. For example, instead of saying cardiovascular disease, say heart disease. Instead of saying sodium, say salt. Keep it simple. Don't focus on the medical explanation of illness. Instead, focus on actions and new behaviors that the participants can do. Instead of explaining how plaque builds up in the arteries, demonstrate fitness behaviors that will keep the heart healthy. You only have a few minutes with each person. It is better to leave them with an activity or behavior than just knowledge alone. Do speak concisely, present 3 or 4 main points only. Any more and your health fair participants will have too many facts in their head and probably won't remember any of them that well. Do emphasize verification. Ask participants to teach back to you what you teach them to make sure they understand your point. And finally, do encourage participants to ask questions and have a backup plan in case you don't have the answer. Researchers have reported that an unorganized health fair can cause tension and stress for participants and can actually skew screening results. So, at some time between the end of this video and the beginning of your health fair, sit down with your group and organize your key messages for your health fair and how you will say them. Practice delivering your 3 or 4 main messages without medical jargon, without focusing on the pathology of the illness, and while speaking concisely and understandably. Let your teammates stop you if you are using too high of a health literacy level, and brainstorm how to simplify your communication. The third and final concept we will cover for effective health promotion is cultural competence. The CDC defines cultural competence as behaviors and attitudes that enable effective work in cross-cultural situations. The word culture here means all of the patterns of human behavior that include, but are not limited to, language, thoughts, actions, customs, beliefs, values, and so on. For you, cultural competence means relating to your participants in the midst of their unique culture. Think about this. Our health behavior depends on the way we understand the cause of illness. It is important to communicate with participants in ways that are culturally acceptable and relevant to them, and that do not come straight out of a textbook. You are now a salesman or saleswoman of health. In order to sell healthier behavior, you need to understand your audience and tailor your message so it's easily understood. Want kids to exercise more? Make it fun. Want elderly participants to fall less frequently? Make prevention simple. Tailor your messages. You may personally understand the importance of a healthy life, but your audience may not have the same background and knowledge base to be able to agree with you. It is your unique privilege to deliver culturally understandable messages to your health fair participants and sort of convince them to be healthy where they are and within their own culture. Before we go, we've mentioned the term target audience several times. While you know to tailor the messages for each of the kits and for the different cultures represented at your health fair, it is important to recognize that there are also specific community cultures as well. There are links at the end of this video to direct you to the U.S. Census Bureau website. Type in the city or county where your health fair is taking place and learn some basic facts about your target audience. Use this website and talk to organization leaders in your area until you have a basic understanding of the area demographics, socioeconomic level, age distribution, general English proficiency level, and poverty level of the community members that may be at your fair. Knowing this information will help you understand your audience and adapt health messages to their culture. Although U.S. Census percentages may be helpful in creating generalizations to help tailor your health communication approach, be careful not to stereotype participants. There will always be plenty of people who deviate from any generalization. So I'm asking you to find an almost impossible balance. Tailor your approach specifically to this population, but also expect everyone to be individuals. Thank you for watching this video. I hope it was helpful in preparing you to implement a fun and successful health fair. For all groups affiliated with UTMB, the Department of Preventive Medicine and Community Health has 4 separate health fair kits you can pick up from Ewing Hall. The first kit is called Rethink the Drink, and it encourages teenagers to switch from super sugary drinks to healthier drinks like water or natural juices. The next kit is a children fitness booth that contains 4 different games to teach children how to exercise and how to enjoy physical fitness. The third kit is a sun safety booth that explains to parents how to protect their bodies and their loved ones from skin damage. The last kit is an elderly fall prevention booth that explains different ways for elderly participants to decrease their chances of experiencing a traumatic fall. Putting the 3 health promotion concepts that we've talked about today into practice will make using these kits worthwhile. By using the 4 P's of health communication, being understandable to participants with low health literacy, and communicating in a culturally competent way, you are well on your way to hosting a fun, effective, and maybe even life-changing health fair. I hope this video has been helpful in preparing you for your health fair. Please contact Dr. Arcari at Ewing Hall with any remaining questions or concerns. And remember, be flexible, be respectful, and have fun. And thank you on behalf of the Department of Preventive Medicine and Community Health at UTMB for serving the Galveston community.